Hi, how are you guys doing today?
Die.
We've been fine. We've been good.
Great. How are you feeling?
Die.
Good. Good. What have you been doing with your new time off since the stroke?
Kid.
Knitting? Very good, very good. For who?
Kids.
Your kids? That's really great.
No. Kids.
My kids. She means her grandkids.
Oh, your grandkids? That's really nice. So last week was your first session, and we completed the Boston Diagnostic Aphasia exam. Your strong points were auditory comprehension. The areas that we're going to work on today and throughout therapy are your repetition, your speech clarity, and increasing your verbal output to help you communicate better. And to do this, we're going to use a technique called melodic intonation therapy.
What's that?
Melodic intonation therapy uses the right side of your brain to rebuild language. It uses the melody and intonation of singing to approximate the normal prosody of speech.
What's prosody?
Prosody is the rhythm and stress that we use normally when we talk. So we're going to use the undamaged areas of the brain not used in language to rebuild new pathways to activate your language.
So you're just going to sing to her and she'll be able to speak?
Not exactly. We're going to use 2 to 4 simple notes to intone common phrases and sentences that your mother uses. We can't use any tones too close to familiar songs or else she'll start singing the songs. The goal of MIT is to increase her verbal output through specific stages on a hierarchy of steps. Nicole, let's give this a try. We're going to begin at the elementary level. Okay, Nicole, place your left hand on the table. By tapping your left hand, this further activates the right side of the brain that we're targeting. So, Nicole, let's look at this picture. In this picture, the nurse is asking the patient a question. She's asking him how he is. Let's practice what his answer might be. Just listen first. I am fine. I am fine. Now say it with me. I am fine. 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 Now repeat me. I am fine.
I am fine.
What did you say?
I am fine.
Excellent job. Let's try another one. Now let's take a look at this picture. In this picture, the man is telling his nurse something. He's giving her a command. His bed is a mess. Let's practice what he might say. Make my bed, make my bed. Let's say it together. Make my bed, make my bed, make my bed, make my bed, make my
Make my
We're going to try another one. In this one, we're going to move on to the next one because we don't want her to get stuck on a troublesome phrase.
Okay.
So now we're going to try this picture. In this picture, this man is giving the other man a present. Let's practice what he might say. Thank you, 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 thank you. Now repeat me. Thank you,
Thank you,
What did he say?
Thank you.
Excellent job.
Wow, that was amazing. I understand it now. So, what comes next?
Well, that's all for today's session, but in the upcoming sessions, we're going to work towards the intermediate and finally the advanced levels.
Okay, what are those?
In the intermediate level, it's similar to the level that we just did, except the wait time between my response and her response is longer. And in the advanced level, we're going to try our best to return to normal speech as close as possible. So we're going to use normal prosody and more difficult sentences. To do this, we're going to use a type of transitional speech known as speech song, and that is where the rhythm and stress are focused on and we begin to lose the tone pattern.
Okay, well, thank you so much. That sounds great. What do you say?
Thank you.
You're welcome. Excellent job. Let me know if you guys have any questions.
Okay.